So today our topic is going to be on leaky gut syndrome. And a lot of you are saying, what in the world is that? Well, let's talk about it. So what exactly is leaky gut? An unhealthy gut lining. A leaky gut is an unhealthy gut lining that have large cracks or holes, allowing partially digested food, toxins, and bugs to penetrate the tissue beneath it. This may trigger inflammation and changes in the gut flora, normal bacteria, that could lead to problems within the digestive tract and beyond. The research world is booming today with studies showing that modifications in the intestinal bacteria and inflammation may play a role in the development of several common chronic diseases. So what are the causes of leaky gut? There's food involved, gut infection, toxin, and stress. I'll go a little more into that. So a poor diet is one of the leading factors of leaky gut syndrome. Processed food contains many ingredients that can lead to leaky gut. In fact, gluten is the number one cause. Gluten causes the gut cells to release zonulin, a protein that can break apart the tight junctions in your intestinal lining. Other inflammatory foods such as dairy or toxic foods such as sugar and alcohol are causes as well. Infections, toxins, and stress are the other three important factors that can cause leaky gut symptoms. The most common infections caused are candida overgrowth, intestinal parasites, and small intestinal bacterial overgrowth. Toxins come in from medications, including NSAIDs, Motrin, and Advil, steroids, antibiotics, and acid-reducing medications. Environmental toxins include mercury, pesticides, and BPA from plastics are also causal agents. Finally, stress can also be a cause. So what are some of the symptoms that a person may have? Digestive issues such as gas, bloating, diarrhea, or irritable bowel syndrome. Food allergies or food intolerances. Brain fog, difficulty concentrating, ADD or ADHD. Mood imbalances such as depression and anxiety. Skin issues such as acne, rosacea or eczema. Seasonal allergies or asthma. Hormonal imbalances such as irregular periods, PMS or PCOS. Diagnosis of autoimmune diseases such as rheumatoid arthritis, Hashimoto's thyroiditis, lupus, psoriasis, or celiac disease. Diagnosis of chronic fatigue or fibromyalgia. If you're experiencing any of these symptoms, leaky gut may be the culprit. Top triggers: refined sugar, dairy, gluten, medications, environmental toxins, and infections. So who gets leaky gut and why? We all have some degree of leaky gut, as this barrier is not completely impenetrable and isn't supposed to be. Some of us may have a genetic predisposition and may be more sensitive to changes in the digestive system, but our DNA is not the only one to blame. Modern life may actually be the main driver of gut inflammation. There is emerging evidence that the standard American diet, which is low in fiber and high in sugar and saturated fats, may initiate this process. Heavy alcohol use and stress also seem to disrupt this balance. We already know that increased intestinal permeability plays a role in certain gastrointestinal conditions, such as celiac disease, Crohn's disease, and irritable bowel syndrome. The biggest question is whether or not a leaky gut may cause problems elsewhere in the body. Some studies show that leaky gut may be associated with the autoimmune diseases. Some I've already discussed: lupus, type 1 diabetes, multiple sclerosis, chronic fatigue syndrome, fibromyalgia, arthritis, allergies, asthma, acne, obesity, and even mental illness. However, we do not yet have clinical studies in humans showing such cause and effect. How do we treat leaky gut? Dealing with leaky gut and prevent symptoms by following the 4R approach. Remove. Remove all inflammatory foods that can contribute to leaky gut, such as gluten, dairy, corn, soy, and eggs. To practice natural health, you'll also need to ditch toxic foods, including sugar, caffeine, and alcohol. Finally, eliminate any gut infections you have, whether caused by candida overgrowth or small intestinal bacterial overgrowth or parasites. Replace the bad with good. Adding leaky gut supplements such as digestive enzymes to your regimen will help support optimal digestion and nutrient absorption, as well as assist your body's intestinal repair and inflammation responses. In addition, re-inoculate. Restore the beneficial bacteria in your gut with high-quality, high-potency probiotics to reestablish a healthy microbiome. I recommend 100 billion CFUs, colony-forming units, while dealing with symptoms. Transition to 30 billion CFUs as a maintenance dose. Repair. Provide your gut with essential nutrients. Is a supplement called GI Revive. This supplement contains powerful GI permeability support ingredients. GI Revive nourishes and soothes your gut cells, restores your gut's natural mucosal lining, and maximizes gut-mending fatty acid production. Another supplement as Digest Gold, betaine and pepsin, magnesium glycinate, Saccharomyces boulardii 2, symbiotic, which is a prebiotic and probiotic. One of my favorite gut healing supplements is L-glutamine that is rich in amino acids that quite literally seal the leaks or perforations in your gut by repairing damaged cells and building new tissues. How do you know when leaky gut is repaired? Once you follow protocol to repair your gut, your symptoms or a lack of them are the strongest indication of whether or not your gut is healthy. A few good signs your gut is healing or in the right track. Digestive issues disappear. Gas, bloating, heartburn, or acid reflux, and constipation are some of the first signs of the leaky gut. This is especially true if gut infection played a role in your leaky gut. When those symptoms start to dissipate and then go away completely, this is a good sign your hard work is producing results. Food sensitivities go away. If you have increased intestinal permeability, you likely also have multiple food sensitivities because partially digested food particles are escaping via your bloodstream and your immune system is attacking them. Another sign your gut is repairing is that you'll be able to eat foods that once caused digestive problems. Skin issues also clear up. Skin issues are another common symptoms. Whether it's eczema, rosacea, dandruff, rashes, or even acne, most skin issues are an outward manifestation of an internal problem in the gut. That's why once your gut begins to repair, you will likely see your skin issues begin to subside as well. Autoimmune labs improve. Because gut health plays such a critical role in your immune system, repairing your gut also often leads to improvement in your autoimmune lab markers. Many patients see their lab results improve, and some even see their antibodies go negative. You are your optimal self. If you're dealing with a leaky gut, you are very likely living with symptoms that affect the quality of your life in some way. A good indication that the gut repair program is working is when your energy and vitality has returned. You've regained mental clarity, your mood has improved, you've returned to your ideal weight, and you feel like your best self. I want to give special acknowledgement to healthquestvitamins.com, the Cleveland Clinic, Harvard Medical, Dr. Amy Myers, MD.com, where I was able to get this information and provide it for you. Trust me, it is true. I'm a living testimony of it. I have friends that can speak of it on, so I hope you'll take heed. Please join us in the Zoom room immediately after the service. I'll be happy to answer any questions you may have. Thank you. God bless and enjoy the rest of the service.